Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Today we're talking about women who exercise and as a result miss their periods. Doctor, why do high-intensity sports like running cause a woman to stop having her period?
It really has to do with a normal response of vigorous activity on how periods work. Normal periods are caused by influence from an area of our brain that causes the ovary to produce hormones and release eggs. So when we have really vigorous exercise, what happens is this part of our brain has a decrease in function, and that is a normal response to severe body stresses, including marked exercise, that causes a decrease in the hormones that then influence the ovaries to produce their hormones and to release eggs. So that is what causes irregular periods or lack of periods in women who are really vigorous exercisers. It can also occur in women who have really vigorous activities such as dancers. So it can also happen in what you might consider your career choice, as well as in women who vigorously exercise.
Does a lack of estrogen play a role, and how?
What happens is that with this influence of the stress of high-level exercise on the brain, then what that does is it no longer causes the ovary to produce the estrogen that it needs to produce. And so your estrogen levels drop dramatically. So you have much less estrogen production than you normally would. And so that drop in estrogen production prevents our lining of the uterus from producing, and that's what stops our period.
Some women believe that missing a period or even a few years worth is proof that they're training hard. Does this cause long-term damage?
Marathon runners sometimes say, if my periods didn't stop, then I wasn't training hard enough. And that is a way of looking at the training. They did a study on 28 college students and found that if they were vigorously training, the vast majority of them had irregular or no periods. So it's true, when you do vigorous running, vigorous training, it's not uncommon to stop having periods. Having said that, it is dangerous. What happens in that situation is, without producing the hormones from the ovary, particularly the estrogen, what will happen is that your bones are vulnerable. And that's one of the bigger issues. If you lose estrogen, your bones stop growing. If you're still young, your bones are still growing. If you're a little bit older, then you'll begin to lose bone. And so there is a long-term risk of having less bone thickness than you otherwise would, and a future of osteoporosis, or very thin bones that can fracture when we're older.
Does anorexia play a role in this?
There's something that is called the triad, or the athlete's triad. And that basically is a combination of exercise causing absent or very light periods, having low body weight, and so being quite thin, and getting osteoporosis. So what I just talked about, those three things are this triad, so this female athletic triad. And so yes, if you are very thin, if you also have anorexia along with the heavy exercise, then you're even more likely to lose bone, because now you don't have the weight that helps build bone as well as the estrogen that helps build bone.
Could missing periods for so long cause infertility?
If you continue to exercise very vigorously and you want to get pregnant, then that can be a factor. There's ways of giving yourself back estrogen to protect your bones, and we do talk to women about that and how to do that. It, however, doesn't allow women to produce eggs, and in order to get pregnant, you need to release an egg. So there are medicines you can take that replace this hormone from the brain that stimulates the ovaries to produce estrogen and release eggs. So sometimes these women will need that hormone added.
When is it the time for a woman to see their doctor?
I do think it's important to see a physician if you have irregular periods for any reason, or if you go past age 16 and you don't have a period. Now, some women who start to exercise really young won't start their period, so that's important too. Or if you had periods and then you stop them. The reason why is if you have low estrogen levels and it is affecting your bone, you want to see a gynecologist, and that person can talk with you about adding back estrogen. And it's a pretty simple thing to add back estrogen. I've talked to a number of young women about that. It's a simple pill that you can take. Sometimes women take birth control pills that has estrogen in it if they need the birth control pills, or you can take a smaller dose like women take after menopause when they stop making estrogen. But yes, go talk to your doctor if you stop losing periods or you never start them, and it may be related to either diet and or exercise.